Learning cold snare polypectomy using simulation-based mastery learning. Cold snare polypectomy is the most common therapy performed in colonoscopy. Trainees learn cold snare polypectomy using the apprentice-based see one, do one, and teach one method. However, the learning curve is almost flat, with less than 10% of trainees becoming competent by the completion of fellowship training. Simulation-based mastery learning could improve the efficiency and effectiveness of learning cold snare polypectomy. Our initial trial, however, showed only modest competency after SBML. This video, we will present our revised curriculum. We hypothesized that simulation-based mastery learning could improve the efficiency and effectiveness of learning cold snare polypectomy. Complete deconstruction of cold snare polypectomy steps is required to create the curriculum. The deconstructed steps of colonoscopy for cold snare polypectomy are shown here, including the techniques and components on handling, insertion technique, looping, torquing, and circular examination. The curriculum content was targeted to the year of fellowship training with escalation of skills. 32 trainees participated in the cold snare polypectomy curriculum.
So first, we need to achieve good visualization of our field. We need to clean out any debris, suction water, adequately insufflate as well to identify our lesion. So here, I'm able to see my lesion. It's what appears to be a sub-centimeter sessile polyp. So in this case, I'm going to be performing a cold snare polypectomy. So I'm now inserting so I have to first position the lesion at the 5 or the 6 o'clock position to be able to do the procedure properly. You also need to ensure that the scope is stable in such a way that if I remove my right hand, you can see that the field is not moving. So positioning it close to our lesion. So now I'm going to ask my assistant to open the snare over the lesion. Open snare. It's also important to ensure that there is a closed loop communication between the endoscopist as well as the assistant. So here you can see that the snare is actually a little sideways, so we can just try to maneuver using our knobs. So as to be able to catch the entire lesion, with the goal of also attaining some normal tissue. So now that I'm able to get the lesion, so I'm now going to do suction. Going to suction, push the instrument, and then ask my assist to close the cut. Close the cut. So after which we need to inspect the site for adequate removal of the polyp. So as we can see in this particular case, we were not able to completely remove the polyp. So we need to perform the procedure again to ensure that we're able to totally remove the lesion. So open snare. Okay, so again we will repeat the procedure. Going to suction and ask my assist to cut. Cut. So after which we are going to again inspect our site. So now we can see that we were able to adequately remove the entire polyp with no remaining lesion.
All trainees reached cold snare polypectomy competency at the completion of the simulation-based mastery learning training. In conclusion, a cold snare polypectomy curriculum that is based on the principles of science of expertise can be created and lead to high rates of competency. The curriculum must include mastery of one-hand handling of the endoscope, with approximately 4 to 5 hours of experiential cold snare polypectomy training.